Hello, my name is Alejandro Deca and I am going to talk about cystine crystal bones in bone marrow. This assignment was done by the teacher John Moscoso. Cystine crystals in bone marrow is a rare autosomal lysozyme storage disorder caused by a defect in cystine transport. This fully soluble amino acid accumulates in the lysosome of the various organs, especially kidney, inducing progressive kidney failure. Patients often suffer cytopenia associated with cystine crystal in the bone marrow. Now we pass to a video.
Cystine kidney stones, one of the hardest formations of kidney stones, occur most often in children and young adults with a rare hereditary disorder known as cystinuria. While no cure exists, people with cystinuria usually develop cystine stones throughout their lifetimes, unless they take preventative medications or receive kidney transplants. Less than 1% of kidney stones in adults and 6 to 8% in children are made of cystine, a crystalline sulfur-containing amino acid. What causes cystine kidney stones? While healthy kidneys absorb cystine from the urine and transfers it to the blood for reabsorption, the kidneys of people with cystinuria do not reabsorb cystine properly and cause a buildup of the amino acid in the urine. Eventually, this buildup of cystine crystallize and form cystine kidney stones. Researchers believe genetic mutations cause cystinuria.
Now we talk about applications in medicine. Treatment consists in three things of lifestyle. This means to drink more water, don't drink alcohol, and to do exercise. The pharmacological treatment consists in the use of cysteamine to avoid the accumulation of cystine in the organism. Now we pass to another video.
I was first diagnosed when I was 22. I had an appointment with a family doctor. I went to the doctor's office and almost passed out. He said, "You have cystinuria." Well, what's cystinuria? Kidney stones, you're going to get them over and over and over. The number of procedures I've had is really hard for me to tell. I've had so many of them. You never know when it's going to hit you. Just the pain from the stones. I've been somewhat fortunate. I don't get as many stones as some people do, but mine grow big. And I don't pass. I passed very, very few stones. They start to come down, they get lodged. You get terrific pain. You climb the wall with it. I had a stone, and we were going to Allentown, Pennsylvania, to a doctor. I literally laid in the back seat with a pillow around my belly, just excruciating pain. When you're feeling good, do something. It's hard when you have scheduled vacations. You can't just say, well, I went, we do it. I do the best I could.
One of the worst things is not being able to do anything. As you want to help him out somehow, the patient, with when they're in pain, and there isn't a thing you can do. One thing I want to get across to people is it is a terrible disease, and some people have it worse than others. But when it isn't a life sentence. You still can enjoy life to a certain degree. And when you're feeling up to it, do it. Because no one knows how long they have. And enjoy life. And sometimes it's the simple things that make you happy. You don't have to go on a lot of trips. Just being with your partner and seeing them and the feeling good. Do what you want to do when you can.
Now, pros and cons. These diseases don't have any advantages. Actually, it has many disadvantages, including the cause of renal failure, growth failure, milk anemia, hypophosphatemia, hypophosphateminosis D, glucosuria, proteinuria, and polyuria.
Today I'll be presenting my genetics topic about cystinosis. Cystinosis is a rare disease. Most children with this can only live to about 40 years of age. It is an autosomal recessive disorder. The problem is that cystine cannot get out of the lysosomes. Cystine crystals build up and destroy the cells. This is an illustration of the problem. On the left is a normal cell with cystine, which are yellow ovals leaving the lysosome. In the middle is a cystinosis lysosome where the cystine cannot get out. On the right is a treated patient. The drug, which are the green shapes, make the cystine able to leave. Cystinosis would not be seen on a normal karyotype. If you look at the 17th chromosome closely, you will find a mutation on the short arm of 17 called 17p. The gene is called CTNS. This gene codes for the protein which carries cystine out of the lysosome. Cystinosis is diagnosed by lab and physical findings as well as symptoms. Labs show increased levels of cystine in the patient's white blood cells. Physical findings are eye problems and growth problems. Patients with cystinosis do not like bright light and are often thirsty and urinate a lot. 3 types of cystinosis. A. Nephropathic, which causes kidney and eye problems. B. Intermediate, which is similar to A but starts later. C. Non-nephropathic, which only has eye problems. This slide shows a 39-year-old man who is only 4.5 feet tall. Look at how the rickets has deformed his hands. The lower right picture shows the crystals built up in his eyes. The red arrow points to the crystals of cystine in the patient's cornea before treatment. The green arrow points to the cornea after treatment. The gray arrow points to the lysosome full of cystine, which is a clear pink area. Drug therapy is available, but you have to take a pill every 6 hours for the rest of your life. Cystigon is the drug's name. It reacts with cystine to make it fit through other exit pathways from the lysosome. Cystinosis is an autosomal recessive which requires 2 parents as a carrier to have a child with a problem. Rarely a child can inherit both chromosomes from their mother. This is called uniparental disomy. On the left, data is a normal genetic material. In the middle picture, the blue arrows points to mom's mutation. The red arrow points to the child's mutation.
Now, this should apply in Ecuador. There are no registered cases in Ecuador. Most of the cases of this disease are registered in Europe, especially Spain. Now, conclusions. This disease can cause renal failure in long term. Treatment consists only in the reduction of cystine in the organism.
This is a multi-organ condition, and as such, it's one of the rare diseases that affects everything, not just the kidney.
Our first indications with there being difficulty with the eyes would be riding in the car, extreme painful sensitivity to light, just crying because of the light hurting her eyes.
I was really sad because I have something with my eye problem. I was sad because of that.
She came home one day and said, "Mom, I'm really having trouble at circle time seeing, what the teacher's doing, having, difficulty seeing the book that she's reading to us."
Dad, I couldn't really see a book, and it was holes. I wanted to go to a nurse to tell her what happened.
Patients may develop not only squinting of the eyes and an unpleasant feeling and pain sensation if they are not treated. They may have poor vision or blurry vision, but also eventually they may have some secondary changes in the eyes.
It feels like you have an eyelash stuck in your eye all the time. And looking into lights and stuff, and like a flash is the worst thing ever. And yeah, it's not very fun.
Around 5 years old, we started to notice an increase in light sensitivity and an increased difficulty with the eye exams and an increased level of crystals in the eyes, and that prompted us to pursue, obtaining the eye drops.
It is extremely important to manage crystals in the eye, in my opinion, as early as possible.
I think if we have, as a means of teaching and explaining to the family and patient the importance of taking the medication, a picture, a photograph of the child or adolescent's actual eyes with the crystals, this is a dramatic teaching tool that should be encouraged.
It's a little scary because, you see the scan of your eyes, if you see crystals.
The recommendations have been, as long as I've been practicing, to give the drops on an hourly basis during the day.
Thanks, that's all.